Hey everybody, how are we doing today? My name is Mark. I'm a PA in orthopedics, and today we're going to talk a little bit about some patient education for de Quervain's tenosynovitis. So let's start. What the heck is de Quervain's tenosynovitis? Well, that is a inflammation, irritation, overuse, a tendinopathy of two tendons in kind of the wrist thumb area here, the abductor pollicis longus and the extensor pollicis brevis. Usually this is a clinical diagnosis. Your provider is usually going to diagnose this by something that we call Finkelstein's test. Flex the thumb, we're going to grab that thumb, we're going to ulnar deviate. I do have a video going a little bit more in depth on the Finkelstein test if that's what you're interested in, and I will link that below. Although de Quervain's is usually a clinical diagnosis, your provider may very likely recommend something like a diagnostic ultrasound or maybe something like an MRI of the wrist, just to kind of, one, evaluate the extent of the damage to the tendons, and two, make sure there's nothing else going on. So we've been diagnosed with de Quervain's tenosynovitis, inflammation, irritation, tendinopathy. Let's talk about kind of what to expect, some treatment modalities, and kind of where we go from here. On a very conservative side of the spectrum, there's a lot we can do. Anything from bracing. There's a fancy wrist brace that kind of comes up and grabs the thumb called a thumb spica wrist brace. This is a great option for short-term immobilization of the thumb and wrist to kind of give those tendons a little bit of a break. Another great option on the conservative side, physical therapy, kind of working on range of motion, strength, function, stabilization, and supporting those tendons is a great option as well. Your provider may also recommend some anti-inflammatories, whether those kind of be over-the-counter, ibuprofen, Advil, Aleve. Could also consider like a prescription strength anti-inflammatory. Sometimes for these tendinopathies, we also give like a low dose muscle relaxer as well. All great conservative options. So let's say we've tried our conservative options. Next steps. There are also some really great injection options as we kind of move up and ramp up that treatment. Option number one, steroid injection. Corticosteroid injection into that area can be helpful in alleviating some inflammation, irritation, and pain. If we have some severe tendinopathy or something like some partial thickness interstitial tearing, well, before I treat that, what the heck is that? Sometimes these tendons fibers can actually kind of become further damaged. If tendinopathy is kind of an irritation, inflammation, kind of picture partial interstitial tearing is almost like a little rip in the cord. Pretty common, actually, and those are often a little bit more difficult to treat because obviously we have some damage of the tendon. Once we have some pretty substantial damage of the tendon, usually don't recommend a steroid injection or conservative treatment. So that's when I would talk to you about something called a PRP injection or platelet-rich plasma. Kind of one of our fancy regenerative medicine injections that actually works really darn well for this de Quervain's and really actually kind of works to repair and heal the tendinopathy. Awesome. So we've talked about some conservative managements. We've talked about some intermediate injection options. On the super far end, aggressive end of that spectrum, there are some surgical options with surgical debridement where they basically kind of go in there and clean out some of the tendinopathy. That being said, every patient is extremely different depending on your prior health conditions, what medications you're currently on, how you respond to different treatments or different injections. Talk to your provider about your treatment options and come to a decision together. Thanks everybody. I hope we taught you a little something today. If there's ever anything you'd like me to teach you a little bit more about or any questions you may have, let me know. I'm more than happy to put out any information that I can to help you out. Thanks everybody for watching. We really appreciate your time and we hope your de Quervain's tenosynovitis is fixed shortly.